Every successful somatic rehabilitation requires multidisciplinary approach to the therapy, including different techniques and modalities and different type of the homework by the patients. My name is Dr. Ostruchininev. I'm founder of Science of Massage Institute located in Phoenix, Arizona. In this short video, we'll discuss how patients need to use NeckPro 2 as the ultimate tool for the cervical decompression, which help therapists dramatically to achieve stable clinical results. Everybody have different degree of the degeneration in the cervical and lumbar spine. That's normal process of aging. But we would like to avoid spinal surgeries when the disc deteriorate to the critical degree. From that point of view, medical massage protocol to decrease pressure within soft tissue on the neck, as well as the compression of vertebral segment, is #1 treatment option. But it needs to be reinforced. It needs to be reinforced with the set of stretches, which we discussed in the previous video. It needs to be reinforced with correct pillow support at night, which we'll discuss before as well. And now what we will do, we will go over the vertical decompression of the cervical spine after patient gets significant improvement. The vertical decompression cannot be done if the patient has peripheral neurological symptoms, which is pain or dysfunction go to the arm, for example, or to the middle back. It also needs to be correlated with the patient physician. Physician needs to give green light for the application of cervical traction. But when all of that is achieved, the cervical traction in the form of NeckPro is absolutely incredible clinical tool. Clinical results which we able to achieve in combination of medical massage protocols and NeckPro decompression is simply astonishing. We had one patient who had severe degeneration of the spinal nerves to the degree that only complicated cervical surgery in fusion of 3 segments was offered her by Mayo Clinic. And the degeneration was so severe that her spinal nerves on 2 segments, C5, C6 and C6, C7, lost myelin sheaths, which create incredible amount of pain on debilitating level. And after medical massage protocols and the NeckPro, which she's doing regularly until this day, and it's already 5 years since we worked on her, that kept her from the surgical intervention, and she has completely normal life without any residual, because now she uses it as a preventive measure to decompress vertebral segment and free spinal nerve from the irritation. To show you how to use it correctly, let me first explain how it works. There is a device which goes into the door, and you can see it's stable. If I pull this end, it creates counter resistance. There is button. If I push button, then there is no counter resistance. So every time when you pull this end down, it creates force, counter force, which you can use as a treatment. There is different traction devices for the neck. Some use mechanical force, some use water buckets. We tried all of that. That's the best of the best. Why? Because it is not using external force. It uses patient body as a tool. And that gives the ultimate solution, because patient control the stretch, not device control the stretch, without any ability to manipulate the weight and the intensity of the traction. I will ask Julia, our Director of Services, to illustrate how the patient should use NeckPro 2 as a treatment between the sessions, and after therapy is finished, how to use it as a preventive measure. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you, and see you in the future. Generally speaking, the NeckPro need to be used after 2 steps preparation. First, hot shower. Secondary stretches for the neck we already discussed in the previous video called hacking your headache. That's the stretches what need to be done directly before application of the NeckPro, and now application by itself. A loop of device goes through the top of the head, and Velcro need to close on the chin. Now this end Julia holds and she pulls her head up. If she continues to pull it right now up, it will break the device. So any further pull down need to be accompanied by her elevating and make her spine straight. So right now, as you can see here, she sits straight. And what she does right now, she releases this end and she now recoil her body down. And that gives you ultimate decompression. So it's not how far you go up. As long as you sit vertical, only what you have to do, you just slowly drop the lower part of the body, and that gives you decompression. The patient needs to put alarm clock for 1 minute, and they're sitting in this position completely relaxed with the decompression of the body for 1 minute. After that, she gets up, push button which releases pressure within the system. Now she also pull it down, but she pulls down only to control weight of the head. Now she put arms both on her thighs, she inhales and she look with her eyes to the right while she rotates to the right. Eyes need to go first, need air, bring in the middle position. Inhale and then go during exhalation. She does it 5 times. And then she inhales and she look with her eyes to the left and follow with rotation 5 times. After she done it 5 times to the right and 5 times to the left, that's the end of the therapy. Thank you, Julia.
You're welcome.
Patient put alarm clock for 1 minute. Completely relax. Recoil lower part of the body. How far patient releases lower body depends from the symptoms. Patient cannot overstretch. It's just very gentle procedure. You slowly recoil body, start to feel any discomfort, don't recoil anymore. Just stand on the same level and wait for the alarm clock in a minute. So for 3 days, patient does exactly the same. Hot shower, stretches, and NeckPro for 1 minute, then 5 rotation to the right and 5 rotation to the left during long exhalation. On the 4th day, they add 2nd minute. Now for 3 days, they do 2 minutes with the NeckPro vertical traction, follow 5 rotation to the right, 5 rotation to the left. On the 4th day, they add another minute, which is now 3. Then they do 3 minutes for 3 days and add another minute, which is 4. And then every time it follows 5 rotation to the right and 5 rotations to the left. Patient do it 1 time per day between the sessions, and then she will do it or he will do it 1 time per day after hot shower as a preventive measure of decompression and decreasing pressure on the disc. And that's only ultimate solution, because in the scenario of the NeckPro, there is no device which stretches the neck. It's the patient lower body gently decompress vertebral segment, and this is irreplaceable clinical tool. If you would like to dig deeper in the clinical application of medical massage, help patients in the very complex clinical cases, drastically increase your income, click on the link below and we will see each other in the classroom. Thank you for watching this video, and if you have any questions or would like to leave the comment, please do so, and we'll see each other again. Have a nice day.